All right, well, welcome everybody. Good afternoon, and thank you all for attending the 2024 Camp Directors Meeting. To introduce myself first, my name is Christopher Candell. I am the soon-to-be program manager of our Children's Camp program. You will also hear from Ann Spooner today. She's one of the supervisors for the Children's Camp program. I'm going to start off today by going over some updates and just some guidance that was provided by New York State regarding children's camps this year. And then Ann is going to be reviewing some commonly cited violations, what we're seeing most frequently on the field from 2023. We are going to record this presentation, and then we are also going to send out a PDF version to everybody after the presentation. So you'll all be able to watch it again, and then you'll have your own copy to review at a later date. We are going to have 2 breaks for questions. So for now, we are going to have everybody muted. So if you do have any questions, just hang on until we get to those breaks. We'll unmute everybody, and then you can ask your questions if you have any. Feel free to also enter any sort of questions into the chat, or you can raise your hand as well. So when we do get to those breaks, we can answer the questions that you have. And before we get going, I do want to say a big congratulations to Jeff Minder. As you may see here, his name is not on the bottom of this presentation. Jeff is actually going to be leaving us after this season. Jeff's been with the department for about as long as I've been alive, so he spent a good amount of time with the department, and he will be truly missed. And I'm sure he's hating that I'm even talking about him right now. But a big congratulations to Jeff and a big thank you for everything that he's done with the Children's Camp program. I'll start here. Going to start off with COVID. Just like 2023, there is no specific COVID guidance from New York State. COVID is being treated like any other communicable disease, and with that, there is no specific guidance on how to handle COVID. It is just any other airborne disease that you would have at camp, and if anyone does come down with COVID, whether it be a camper or a staff member, you just have to report that to the department, again, like any other communicable disease at camp. That has to be reported to us within 24 hours, and you would send the standard illness report form or the illness outbreak form if there was a number of people who were positive for COVID at camp. If you do want any kind of guidance as far as COVID or any other respiratory virus, you can find that at the CDC website, which I have linked on the slide right here. Again, you'll get a copy of this presentation, so I'll be able to be linked to that website. And it's just general guidance on all respiratory viruses. There's nothing specific to COVID anymore. New York State drafted some guidance for vaccine preventable diseases, which I'm just going to probably say VPD moving forward, so I don't keep tripping over vaccine preventable diseases. A letter was sent out to everybody about April that went over some guidance and some information about VPDs for children's camps. If you did not get that, we can also send that out to you. So you can throw it in the chat, or we'll have our contact information along the presentation that you can just reach out and request a copy of that, or you can notify your inspector. Measles are another topic that the state wants us to talk about this year. We are seeing yet another rise in cases. In 2024, we already have more cases than we had of all 2023, and these are stats from April. So just 4 months into the year, we already have more cases than we did all of last year. So cases are on the rise, and we've had 113 total cases in the United States, covering 18 jurisdictions, and New York was one of those jurisdictions. So it is out there, and it is something that we want everyone to be aware of. Now, measles is easily transmitted between people. It is highly contagious, and that's one of the reasons it's such a big concern, because it is so easy to spread between person to person. It is spread by the airborne route, much like COVID is, and it can actually live in the airspace for up to 2 hours after an infected person has been in that area, if they were coughing or sneezing. So you may not even know that that person was in that room, and you can actually end up getting the disease. And people can spread it when they are asymptomatic. So just another reason that it is so easy to spread, because you may not even know that you have it, and you're able to then spread it 4 days prior to any sort of rashes, and then 4 days after that rash appears. So very contagious, something that we want all camps to be aware of and keep an eye out for. New York State developed this poster that you see here, just that gives some information on measles. It goes over signs and symptoms, it goes over the onset time, as well as steps that should be taken if you are finding an individual, whether it be a camper or a staff member, that has signs and symptoms of measles at camp. We can, again, a link for this is going to be shared later on in the presentation. We'll make sure that everyone has a copy of it if they wish to have one. And what you can also distribute this to parents or guardians. So feel free to take this poster if you want to inform your parents or your guardians about measles and just what to look out for before they send their child to camp, just so they can keep an eye out for it as well. To be immune, or what we would consider being immune to measles, one of three things. Someone that's born before 1957, obviously that's not going to be your campers, but that could potentially be staff members. If they have record of being immunized, so they have documentation that they received the appropriate vaccinations, or if they have a laboratory test confirming that they are immune to measles. There have been no changes to vaccinations. I know this is a big question every year. Is the state going to require vaccines or immunizations? And the answer is still no. There is no requirement for vaccines at camps. New York State does strongly recommend that everyone, campers and staff, be vaccinated against any sort of VPD, but again, not a requirement. What a camp operator is required to do, though, is maintain records of immunizations for campers. Any camper that has immunizations, those immunizations need to be maintained at the health office with the health director, or just somewhere else that is easily accessible for both the camp director and for the inspector. Now, the campers that are not immunized, you want to make sure that you're keeping a list of those campers as well to document that they do not have the appropriate, well, not appropriate, but that they do not have vaccinations against VPDs. Now, that list will be used if there's any sort of outbreak situation that you know which campers to exclude from camp if that situation arises. So again, the requirement is maintaining vaccination records for those campers that are vaccinated, and then maintaining a list of those campers that are not vaccinated. And there is no requirement as to what the reason for lack of immunization is. It can be for any reason. It doesn't need to be from a doctor. It can be from anybody. It can just be the parent or guardian stating my child is not vaccinated. That is perfectly acceptable, and that is allowed at camp. Now, for staff, there is no requirement to maintain those immunization records, but it's a strong recommendation to maintain any sort of immunization record for your staff, especially those that do not have vaccinations. Same with campers. If you have a staff member that is not vaccinated, you want to make sure that if in the event of any sort of outbreak situation at camp, that staff member is not then adding to that outbreak, that they're not getting ill, that you know which staff members to exclude. Again, strong recommendation for staff. And as camp operators, you can choose to require immunizations at camp if you so choose. That is up to you. It is not something that the state is requiring. Now, the first line of defense against any sort of illness outbreak is educating yourselves and your staff. You should make sure that your staff are aware of the different signs and symptoms of different VPDs, including measles, like we just talked about, so that we can catch outbreaks early and limit their impact. So if staff are aware of what signs to look for, they can easily catch it, find the ill camper or staff member, and separate them before the illness really spreads throughout camp. You do want to make sure that you're also conducting an initial health screening. So when a camper is first arriving at camp, want to make sure there's a general screening process to make sure that they're not exhibiting any sort of symptoms or signs of a VPD. And then also just daily surveillance, having your staff make sure that they're just keeping an eye on the campers, along with general supervision, that they're making sure that they're not showing any signs or symptoms of any sort of vaccine preventable disease. Now, in an instance when there is an illness outbreak, or you are noticing a number of campers that are showing signs and symptoms of a VPD, you want to make sure that the first thing you do is physically separate the ill campers and keep them away from the well campers or staff. Exclude any of those non-immunized campers or staff. So the list I talked about previously, knowing which campers or staff members ideally are not vaccinated and knowing that they should be excluded from camp until the outbreak has sort of run its course. You want to potentially limit entry into the camp if necessary. If you have an outbreak all of a sudden, now you're expected to have a parents' day, or you have some sort of presenters coming in, it may be a good idea to put those on pause or hold, or put those on hold until the outbreak has again passed. And like any sort of illness or outbreak situation, making sure you're reaching out to us and letting us know that there is a situation and reporting it to us within 24 hours. And just to reiterate that, any illness that's either waterborne, foodborne, airborne, once you know that you have a camper with that illness, you just have to reach out to the department and let us know within 24 hours. The phone number is right there that you can call us, as well as our email address. You can email the report forms right to us there for us to review in our office and then just get back to you if we have any questions about it. The most important thing, though, is letting us know. Just notify us. If maybe you don't have all the information yet, you don't have a full list of campers, or you don't have information about the parent or guardian status, or if they went to the doctor afterwards, you were waiting for a follow-up. If you want to hold off on sending the report, at least reach out to us, give us a call, shoot us a quick email, and let us know, hey, this is the situation, this is what's going on. The report is coming afterwards. Just notifying us is what you need to do with that first 24 hours. So reach out to us, let us know, stay in contact. If you don't have the report forms, again, let us know. We'll make sure that you get them. Just reaching out and giving us that heads up within that 24-hour period after noticing any sort of illness or outbreak. Along with reporting, on the left is the injury illness report poster that I'm sure all of you are familiar with. You want to make sure that every camp is posting this, that staff are aware of what injuries and what illnesses do need to be reported to the department. We will have a link to this poster if you want a new copy on the next slide. So just something that to make sure that every camp has and is aware of. And then on the right is a letter that was drafted by New York State about those vaccine preventable diseases. It's a guidance document, goes over a good bit of what I just mentioned. This was also sent out to everybody in April. If you did not get a copy, same thing, let us know, shoot us an email, throw it in the chat, and we'll make sure that you get a copy of it. A number of links for everybody can just be found here, going over vaccine preventable diseases, measles, as well as how to handle outbreaks at camps and that reportable injury poster, like I mentioned. Like I said, everyone will get a copy of this presentation, so you'll be able to go to these links and get any information that you may need about this information. And you are, children's camps are able to access the New York State Immunization Information System, where you are actually able to look up immunization records. You just need to be granted access by the health department. So if any camp does want to gain access to the system, send us an email, php@suffolkcountyny.gov. It's going to be all over this presentation. I think you all know it by now, but reach out to us, send us an email, let us know, and we'll make sure that you get the information to sign up for NISIS. Next, I'm just going to be talking about new legislation regarding AEDs. This is something new for this year, but it's not really going to have a big impact on most of you. So in May of this year, public health law was amended, and it is now requiring that all permitted children's camps have an AED, provide an AED, or have reasonable access to an AED. Now, for pretty much 95% of all of our Suffolk camps, you're already doing this. We have a local law in Suffolk County that precedes the change to the public health law that already required children's camps to have AEDs or have reasonable access to AEDs. So the vast majority of you, there's not much that you need to do, but just to know that public health law has now changed to coincide with our local law, with the change that the public health law is for all children's camps, whereas our local law excluded or exempted traveling camps. So now moving forward, traveling camps in Suffolk County will need to also provide an AED or provide reasonable access to an AED. And for those camps that currently do not have an AED and need to have compliance with this new public health law, these are the steps that you would need to take. First, you would need to register an AED with REMSCO. There's a link right there. It guides you through the process of how to apply for an AED or register an AED with EMS, with the department. You will also need one or more staff member possessing an acceptable AED certification. So this is one of the changes also along with that that's different from our local law is we didn't always require the AED certification. You needed someone who had knowledge of it, but there was no specific certification requirement. So now this year, you need at least one staff member who has a valid AED certification. The good part about this, though, is a lot of the CPR classes that are on our fact sheet include an AED component. So most of you are likely in compliance with this already. But if you want to take a look at the CPR fact sheet, it has a list of certifications that we are accepting, and you just need to look for CPR certs that have that AED note in it as well, that it indicates that it also has an AED component to it. The last part is essentially just an updated safety plan appendix. So that was also sent out to everybody. That was last month. There is a short appendix that needs to be filled out for every camp that goes over some information about the AED, where it's located, what kind of implementation plan that you have. But the most important thing that we want to know is if it is your AED, if it's the camp's AED, or if it's someone else's AED that the camp is using. A camp that is at a school district perhaps is using the school district's AED, or maybe a traveling camp that is using different facilities AEDs depending on where they go. That's really the information that we want to know, but we want to make sure that every camp is submitting that updated safety plan appendix. Like everything else, reach out to us if you don't have it, reach out to your inspector or shoot us an email at that PHP email address, and we'll make sure that you get a copy of that. Just an overview of the AED equipment of what you would need along with your AED. You want to make sure that you have pediatric pads as well as adult pads. You want to check the expiration date on those to make sure that they're still valid. A battery, same thing with expiration date, making sure that the battery is still within that expiration date period. Gloves, towel, a CPR mask, razor, and scissors. So along with everything else to register the AED, you just want to make sure that your AED is properly stocked with the appropriate equipment. Next, I'm just going to do a brief overview of EpiPens. So EpiPens, children's camps are allowed to stock their own EpiPens if they so choose. It's not a requirement. There is no need for a collaborative agreement, so it does not need to be registered with REMSCO like our AEDs, but it is something that camps can choose to do if they want. Physicians are allowed to write non-patient specific scripts, and pharmacies are allowed to dispense them for camps. If a camp is stocking its own EpiPens, you want to make sure that you have staff members that are trained and complete a nationally recognized training course so that they have a certification and are properly trained on the use of EpiPens. So that would be a requirement if a camp is stocking the EpiPens. If a camp has campers with EpiPens, it is a strong recommendation that you also have staff trained on the use of EpiPens, especially those counselors that have those campers in their group. So if a counselor is supervising a camper with an EpiPen, it is a good idea for them to have some knowledge on the use of the EpiPen and how to administer it properly if needed. This is just a chart showing the trends for children's camps in New York State. So as you can see, over the past 22 years, we've had a pretty big jump as far as EpiPen use, not AEDs, EpiPen use. Of course, we have a big dip in 2020, just the sheer number of camps that weren't operating that year. But as you see, it has increased pretty steadily over the past 22 years here as far as EpiPen use goes. And in 23, last year, we had 29 incidents where campers did have to have an EpiPen administered. 12 of them were food allergies, 11 of them were insect stings, and 6 were for unknown allergens. So that 6 right there, unknown allergens, is just a good reason for camps to have EpiPens stocked if they so choose, because you don't always know if a camper does have an allergen. They may not know, their parents may not know. So it is kind of a nice thing to have in case of an emergency where the camper or the parent doesn't know that a child has a specific allergy. And of the 29 EpiPens that were used, 10 were from a camp supply, 14 were from the patient's personal supply, and 5 were administered by EMS or a hospital. So again, 10 from a camp supply, about a third of them were from a camp supply. So again, not a requirement, but it is a nice thing to have in case of an emergency. If an EpiPen ever does need to be administered at camp, it needs to be reported similar to an injury or an illness. This is the report form that you would use. So same with those injuries and illnesses. If there is an EpiPen that has to be administered at camp, this form will have to be filled out and we will have to be notified within 24 hours. If you don't have a copy of the form, again, let us know and we'll make sure that you get a copy of it. Another big change this year is the minimum lifeguard age for children's camps. I'm sorry, I didn't realize this slide was going to do that. I'm just going to do that. So for children's camps, lifeguards must be at least 17 years of age, except for these scenarios. For a swimming pool, 50% of the lifeguards may be 15 years of age or 16 years of age. So this used to only be 16 years of age, but it has now been decreased to 15 years of age. So 50% of your lifeguards at a swimming pool may be 15 years of age. This is only for swimming pools. This does not apply to any natural body of water. So any bathing beaches must have, it reverts to 16 years. So 15-year-olds cannot lifeguard at a bathing beach. They can only lifeguard at a swimming pool. And any sort of wilderness swimming, the age is still 18 years of age. So really swimming pools are the big change here. Everything else is basically the same as what it has been in previous years. There is no waiver requirement. There was earlier before this legislation actually was passed. We were issuing waivers. We're no longer issuing waivers. This is just something that you are allowed to do as a camp operator to have that maximum of 50% lifeguards be 15 years of age or 16 years of age. The National Sex Offender Registry. This isn't new. This is something that's been going on for a couple of years, but we just wanted to make sure that everyone's just reminded of this requirement. So in June of 22, this is when this started. There's a requirement that along with the New York State Sex Offender Registry check, all staff or employees or volunteers, so all your staff, needs to be checked against the National Sex Offender Registry along with the New York State Sex Offender Registry. So it has to be conducted prior to the staff's first day of camp and every year after. So every year before that staff member is starting at camp, they have to be checked against the National Sex Offender Registry and the New York State Sex Offender Registry. And you can utilize this website here, the National Sex Offender Public website, to do those checks. So the first thing that you're going to do for that is you're going to go to that website that I just listed previously. You're going to enter the individual's first name and last name. You're going to search. There's going to be a condition of use that pops up that you're going to agree to, and then it is going to check all states, territories, and Indian country and notify you that everything has been checked and that staff member has hopefully been cleared. Then you do need to maintain documentation showing that the search was conducted for all of your staff. And here's just a screenshot of that website. So right here where this arrow is pointing, that's where you would search. You'd enter their names, click on search, and you'd be able to search for that employee or volunteer. Now, I know some camps do use a third party to do these checks, and that is acceptable. So if you do have a third party that does a national check, you just need to show proof that those employees or volunteers were checked against all states within the United States as well as New York State. So that's perfectly acceptable. If you have questions about a certain third party that you're utilizing, feel free to reach out, let us know, we can check it, but we are accepting those so long as they are checked against the National Sex Offender Registry. After last year, we had the issue with some forest fires, so we wanted to just discuss air quality again very briefly. New York State DOH has a website where you can go and get some information about exposure to smoke from fires. The link is right there. And then we also want to make you aware that you can check daily the local air quality information website, and you can put in your zip code, you can check out your local region, and you can see what the air quality is listed for that day. So if you see up at the top right corner here, it'll show you a little diagram. It's pointing in the green. It says that it's good. And then it will have this chart below where it will go over the different air quality on the left, who is potentially at risk, and then what to do in those situations. So if you have any concerns about the current air quality, go to that link. You can check out what the quality is and then the appropriate action that you may need to take depending on what the quality is that day. Just some additional information that kind of relates to that is just some asthma information. New York State has developed this asthma action plan that you can go online. It will look, there's a PDF, it will look just like this. And this would be for the parents, guardians, or physicians, healthcare providers to fill out an action plan for their child. And it will show that there's this green zone. So basically what certain symptoms or signs are being shown and what would need to be done. And then it goes down for caution level, again, what they're seeing, what kinds of symptoms that they're having, what needs to be done, and then this red zone, what would constitute an emergency and what should be done. So just some information. This is something that parents or healthcare providers can fill out for camp and just something to be aware of for your health directors. And there's also just some additional information for athletes and asthma, as well as a brochure developed by New York State. Then just briefly on sunscreen and sun protection. So campers are allowed to carry and use sunscreen that's approved by the FDA. This is perfectly acceptable for them to do, and there is no need for a written doctor's order. They don't need a script for it. They don't need a doctor's order, nothing like that. They just need to have parental or guardian permission to carry it and to use it. And then they would also be able to give permission for a counselor or staff member to apply it as needed. So these are essentially just permission slips that you would give out to your parents and have them fill it out for their child to indicate that yes, they can carry it, yes, they can use it, and yes, a staff member can apply it as needed. Same thing for insect repellent. It would be the same procedure. A parent or guardian can simply give permission for their child to carry it, to use it, and potentially have it applied by a staff member. That is all I have as far as updates for this year. So what I'm going to do, let's see if there's anything in the chat to start. I'm apologize. Someone said they couldn't hear me. Was everyone able to hear me okay? VPD file, yes, I will resend the letter. I'll make sure that every camp is resent the information about the vaccine preventable diseases. We'll send out that notification from the state to make sure that all of you get that. Are we still required to collect for staff or not? I'm assuming that means for immunization records. And no, there is no requirement to collect any staff immunizations, but it is a strong recommendation. And if you don't want to maintain for those that are vaccinated, the stronger recommendation for everyone who you know is not vaccinated, but not a requirement at camp. Do we need to send an AED on day trips with the bus? Typically, no. Usually where you're going will have an AED, and that's something that's typically addressed per trip in your safety plan, but traditionally, no, that isn't a requirement to always have it on day trips when it's not the whole camp. If it's the whole camp is going, yes, AED goes with the whole camp, but if it's a section of your camp that's going on a trip, that's not a requirement. And it was about the collecting staff immunizations, yep. How do you tailor lifeguards requirements? Let me see if I can unmute you here. Give me one moment, everybody. All right, so I did just set it so you are able to unmute yourself. So if you wanted to just elaborate on the trips for the 15-year-old lifeguards, I think you mean when you are sending your campers to Splish Splash and then you are bringing your own lifeguard for the 1:75 ratio. Is that correct?
Yeah, so it's like on a trip like that, the kids are not together anyway, and they have lifeguards on all of the equipment. And so just wondering what the requirement is. Like we go every year, they have lifeguards on every single piece of equipment. Even if we brought a lifeguard or two or three, there's no way they would possibly be with all of the kids throughout the park. So I'm just wondering like what's required for our trip that we do.
So every trip you are required to, or any offsite swim. So anytime you're doing any sort of swimming offsite away from your camp, there is a requirement to have one lifeguard for every 75 campers. So are you asking if they can be 15? I know you're just addressed like how do they keep track of them? I understand that part, but are you asking about the age requirement or more so about the number of lifeguards that you would need to bring?
Nope. So it sounds like one lifeguard per 75 kids. Even if their parents are present.
Oh, you're bringing the parents on, and it's during camp. Like their
It's
parents are
during
coming, but it
camp, but
is.
we do have heavily chaperoned with parents as well. Yeah.
Understood. Yeah, the code is pretty specific about still having that 1 to 75 lifeguards, but it can also be a pool activity leader, so you don't need to go to that higher requirement of a lifeguard. So at a minimum, you would need
Okay.
that pool activity leader. So yeah, that requirement wouldn't go away regardless of parents. I mean, if the parent was a lifeguard, that's something we would have to bring up to the state. But really, that requirement doesn't change, even though yes, it is a heavily lifeguarded area. The campers are likely online for a good length of the time there because they're on a one person ride, and a lot of that is also addressed in the safety plan. It does go over how you are supervising them during those periods, like how you're supervising them on a ride that is for an individual at a time. But the actual lifeguard requirement, the 1 to 75, yeah, that doesn't change.
Okay. So one lifeguard or pool activity leader per 75 kids. Okay.
Correct. Yep.
Thanks.
Yeah. Anybody else while we move along? Feel free to unmute yourselves. It looks like Ava has a
Yes, I have
question
a
there.
quick. So we do a beach field trip once a week to Smith Point Beach. So we're
Okay.
supposed to be taking our AED with us onto the bus.
So it's all about having reasonable access to an AED. So when you go on that trip, if it's the entire camp that goes on that trip, and there is an AED that is reasonably accessible at Smith Point, which there should be, you wouldn't necessarily need to bring your own. No. So it's all about having access to an AED.
Okay.
It's not always about having your own. It's about having access to one. Yeah. So if your entire trip is going
You
there.
don't need it for the bus trip. That's like a half-hour bus trip.
Oh, I understand. No, you wouldn't need it for that.
Yeah, that's what I wanted to make sure. Okay.
Yep.
Thank you.
How many counselors need the EpiPen training? And so for the AED, there's only a requirement to have one person with the AED training per camp. For the EpiPen, there is no set number of staff that would need it, like how we have the requirements for the first aid and the CPR. You would just want at least one person with training on how to use it. If you are stocking, that would be a requirement that you at least have one person who is properly trained on the use of it. Narcan administration. That's something that I'm going to probably have to get back to you on. Yeah, I wasn't prepared for a Narcan question. From my understanding, almost anyone can use it. There is I believe, a strong recommendation to have it, but I know Narcan is very safe. So even if you do administer it to someone that doesn't need it, there typically isn't any harmful effects, but don't quote me on that. I will make sure that I get a proper answer for you. And when I send out a copy of this presentation to everybody, I'll make sure that I address that in the email.
All right, thank you.
Anybody else before we move along?
I'm not sure if you answered this question because I had the same question as Emily about any pool activity leader training in Suffolk County. Like I heard you said that or a lifeguard. Is it either or?
Correct. Yep. Yeah. So when you're going on when you're doing swimming offsite, that is at a lifeguarded location, you don't need to bring a lifeguard, which is that higher level certification. You can just bring a pool activity leader. So it's one or the other when you're doing those offsite swims. So the pool activity is just a lower requirement course. It's not as lengthy of a course as a lifeguard. So it is another option for you to do. Yeah. So you wouldn't need to bring both. You'd need to bring one or the other.
Okay, and where is the training for that?
I'll send the information on that as well. Yeah. So I'll send
Okay,
over,
thank
there's
you.
there's a contact in Suffolk County that you'd be able to reach out to. So I'll make sure that I send that as well.
I'm sorry to bother you. I think you answered my question when I lost Wi-Fi about the AED. How many counselors need to be AED trained and EpiPen?
Just one. It would just be one for those. Yeah.
Oh, okay, great.
Yep. And then I know a question about, do you need a lifeguard on duty when a WSI is giving a private lesson? Yes, you would. Yeah. So the water safety instructor, especially if they're in the water, is there to instruct. You would still need a lifeguard. When it's at, this is all, again, I'm assuming this is all children's camp related, this private lessons, but yeah, you would still need a lifeguard there at that point.
And to follow up on that, how about a private lesson at someone's home?
We don't get involved in that. It's not something that we would permit. I mean, it would be a good idea too, especially if they're both in the water. Once you have two people in the water, it is always a good idea to have a lifeguard on deck. But we would not, we wouldn't have a stance on a private home. We're talking just children's camps, just permanent programs. Yeah, it would be. But I would strongly, you know, if that was someone that I knew, I would strongly recommend to have a lifeguard on deck or have the WSI stay out of the water. But again, that is not something that the department has, you know, a real stance on.
Thank you.
Ava?
I have a follow-up question regarding the EpiPen training. If we
Mhm.
have an EMT 24/7 at an overnight camp, do we then need one additional staff person with the EpiPen training?
No, as long as they're trained on EpiPen use, which that should be included in their EMT training, no, they would cover your requirement.
Super, thank you.
Yep. Required that a lifeguard gets AED. So is it required that a lifeguard gets AED? I think you mean the AED training. No, nope, that's not a requirement of the lifeguard. It's just that one person at camp would need the AED or the EpiPen training. Often though, the lifeguard sort of a CPR training does usually cover AED, but it wouldn't be a requirement that lifeguards specifically get the AED training. They can likely count as your AED person because often, like I said, the CPR training that they take usually includes AED, but no, they specifically wouldn't need to also have that cert. Where can I get EPI training? That's another thing that I will get back to you on. Yeah, I don't have a list of courses in front of me, but I can find that out for you.
Thank you so much.
And then does the American Red Cross BLS course cover what's required for the day camp? Do you mean as far as AED goes or just in general? BLS is an approved CPR course, and if it says AED in the title, then yes, it would cover. If that answers your question. Oh, just day to day as far as as far as AED, again, if it has AED in the title, absolutely. But BLS in general is an approved course, the American Red Cross BLS. Yep. And along with all this, I can also attach the fact sheets. I know we throw that at you guys a lot, but we can always throw over the fact sheets again if anyone has any questions about the approved courses for this year. All right, so I am going to go ahead and mute everybody again. I'm going to pass it over to Anne, and then once Anne is finished with her presentation, we'll unmute everybody again. We'll have another round of questions, and if you have questions about her section of the presentation, or if you have more questions about mine that you just thought of, we can answer those then. So without further ado, I'm going to pass it over to Anne.
Hi guys, so we just put together the top violation categories from the 2023 inspections. So these are violations that we noted in order of frequency that they were seen. You can go to the next slide. All right, so these are the categories. Obviously, we want to avoid any violations altogether, but for sure we want to avoid the public health hazard violations, those criticals. Those ones are highlighted here in red. So we are still seeing them out there during our inspections. We want to pay particular focus on those. Next slide. All right, so for infirmary medical supplies, this is most frequently cited. As far as medications, we do want to see doctor's orders accompanying any medication at camp. It has to be something signed by a physician listing the medication and the dosage. The script on the medication from the pharmacy is not adequate for that. The medication itself, it should not be expired. And you also want to check the packaging that it's in. Sometimes, for example, EpiPens, we see that the box is not expired, but the pen itself is. Proper administration of medications. So here, if you have an EMT certified health director, they cannot be administering medications. You would only be allowed self-administration by campers in that case. If you have an RN or an LPN, you'd be able to administer, but just want to make sure that you're careful about administering medications. So we wouldn't want to see in your daily log any medications being dosed out by camp staff. But if a camper has medication that they need at camp, they can self-administer in that case. And then proper storage and carrying of medications. Just you want to make sure that that it's kept locked. If it's a controlled substance, it has to be in a double lock container or double lock protected. And you know, keeping the door locked of the room that it's in is not going to be sufficient for that double lock. Campers are allowed to carry emergency medications. They should not be carrying non-emergency medications. All right, next slide. All right, so we do see a lot of equipment that is not in great condition, things like fencing, there might be holes, or the edges might be curling. So you want to just try to take care of that before camp starts. Things like tree limbs, dead tree limbs that are hanging overhead or that may have fallen. You want to take care of that before camp starts. If it is something that happened during camp, maybe a tree fell, just try to rope off that area so that campers are avoiding that hazard. During a pre-op, that would be written as a blue violation, but during your operational inspection, if there's dead overhead tree limbs, then you might be cited a critical violation in that case. Also be careful of your playground equipment. Make sure you're inspecting that. Look for sharp edges. Make sure that there's adequate substrate underneath the equipment, like slides and monkey bars. Those can cause injuries on campers. Next slide. So oftentimes we're citing fire drill not being properly conducted or logged. So fire drills do have to be conducted within the first 48 hours of each camp session. So we want to make sure that any campers know how to get out of a building in the case of fire. So anytime you're going to have new campers coming into camp, you're going to want to have a fire drill conducted within 48 hours. So you might have weekly sessions, maybe bi-weekly sessions. Just make sure that you're conducting those drills as appropriate, and that you're logging them in a log. You should have your fire alarm systems and sprinkler systems tested annually. So we are going to want to see those reports. If you're using a school, then the certificate of occupancy would be acceptable for that in lieu of the fire or sprinkler inspection reports. Just take a look and make sure that your fire panel or your system is operating normally. So the system should say that it's normal. If it doesn't say that it's normal, if it says that it's in trouble mode or it's showing some kind of errors on the screen, you're going to want to have that addressed immediately. If there is an issue with the fire alarm system, you should be implementing a fire watch, depending on the location, if you're inside of a building. And what a fire watch is you're every 15 minutes scanning and doing a walkthrough of any areas that are utilized by campers, and you do have to document that as well. But contact the alarm system company to try to get that addressed immediately so that that fire alarm system is functioning normally. Smoke detectors as well, just make sure that you're testing them, that they're in good working condition, and replacing the batteries as needed and so on. Next slide. All right, vaccination records, Chris already went over this quite a bit. You just want to make sure that you have records for campers if they are vaccinated. If they're not vaccinated, there should be some letter, you know, exempting them or, you know, that stating why they're not vaccinated. And you should be marking those campers so that you can easily exclude them if needed. And incidents of illness or injury should be reported to us within 24 hours. As Chris mentioned, there is a poster that is provided by the state, which if you're not sure of what needs to be reported, you can refer to that poster, which is linked in this presentation. Make sure that you're also completing daily logs for illness and injuries. So at a minimum, you should have the camper's name, the date, the time, the, you know, whatever the illness or the injury that happened and how it was treated, as well as the staff person that did the treatments. You should have emergency contact information on hand for all campers, and it should be complete. Next slide. All right, so swimming, you want to make sure that you have a proper buddy system in place. That involves a buddy board. So the buddy board, it should have campers' names. They should be marked as far as their swimming abilities, the camper pairs. All of that needs to be included on the buddy board, whether or not they're in the water or out of the water. If a camper leaves the water, they need to be reassigned to another camper, so a new buddy. You're allowed to have one triplet pair per swimming area. But if you know one person leaves the water, then you can buddy up that other person with that triplet. Every 15 minutes, you need to make sure that you are conducting a buddy check. All right, and then the swimmers themselves, they do need to be identified as to whether or not, as to their swimming ability. So swimmers versus non-swimmers. We don't want those non-swimmers going into water that is greater than chest deep, and we need to make sure that you're monitoring that. There is this video that you can watch on aquatic safety. It's about 13 minutes long. We won't play it today. But it is a good video. It has good information in it for your staff to watch. As far as your safety plan, you do need to have an approved safety plan on file. If you don't have your safety plan yet approved, please make sure that you are working with your assigned inspector to get that approved before camp starts this year. I know that there's a few camps that still don't have their safety plan approved yet. So make sure that you're following up. These should be kept, you know, up to date as needed. You don't need to send us a new safety plan every single year. If nothing changed, then that's fine. This is only, you know, if there are any changes, if you're adding new trips, just send us those trip safety plan components. Don't send us a whole new safety plan. But just make sure that it's up to date, that it's kept on site. So if an inspector comes for their inspection, they may ask to see your safety plan. It should be there available and ready to go. And also it's something that you're going to want to review frequently yourselves and with your staff. You want to make sure that you're properly implementing your safety plan as well. Things like medication administration, maybe how campers are also moving from one activity to the next, those would all be in your safety plan that you want to make sure that you're following. Every year you do have to submit an affirmation to us. It's part of your application process. It's a one-page document that you just check off boxes indicating what activities your camp is participating in. And that's your safety plan affirmation form that needs to be signed. And basically that's, you know, in lieu of a new safety plan needing to be submitted every year. Okay, next slide. All right, just make sure for personnel that you're doing all of your background checks. Chris went over this as well. Now you need to do the National Sex Offender Registry clearance as well as the New York State clearance. And just keeping that separate list of campers that are not fully immunized. Go to the next slide. Okay, so exit signs and emergency lighting, we see a lot of this as well, you know, where the exit sign may not be properly illuminated, you know, it doesn't function when we test it, or the emergency lights don't function when we test them. And just make sure that the directional signs are pointing to the exit, the place of egress. Occasionally we do notice that they're not pointing in the right direction. Next slide. All right, so for staff qualifications, you just want to make sure that you're doing all those sex offender registry clearances and that you have the proper certification for your staff, like first aid or CPR. So every year the state sends out those fact sheets that have all the approved certifications listed on them. Depending on the type of activities that your camp is involved with, you might require a higher level first aid certification. Just check to make sure that the certification that you are providing or that's covered is listed on that New York State fact sheet. Make sure that your ratios are adequate. So your ratios, you know, during non-passive activities might be different than passive activities or movement between activities. And, you know, that includes if a camper needs to go on a bathroom break, make sure that you have adequate staffing so that that's not going to bring you outside of the ratio that you're required for that activity. There should be visual or verbal communication with your campers. We just wanted to mention that the state does not allow remote monitoring systems or video surveillance as a substitute for supervision and lifeguarding. There was an incident recently where video surveillance was being used in lieu of a lifeguard. And we just want to make sure that you're aware that that's not acceptable in lieu of an actual person being there supervising or lifeguarding. And as far as CITs are concerned, CITs are still campers. They have to be supervised as campers. You can utilize them as up to 10% of the total number of counselors. And depending if you're an overnight camp or a day camp, you know, there's a difference in age there, 16 years old at an overnight camp or 15 at a summer day camp. But they also cannot be independently supervising other campers. So just make sure that you're not sending a camper to the bathroom with a CIT supervising them. They can't independently supervise campers. All right, and then last, just some electrical and, you know, facility maintenance items. Just make sure you don't have any exposed electrical wiring, that you have your junctions covered. outside electrical outlets, you'll want to have those weatherproof covers protecting the outlet. And any kind of tents or canopies that you're using, just make sure that it's a flame retardant material. So you're going to want to see this stamp that you see there on the tent itself, indicating that it's flame retardant, and we'll be looking for that as well during our inspections. So that's all I have for these top violations that we're seeing out in the field. If you guys have any questions, we'll be happy to answer, and thanks again for coming. The DOH medication log, we don't have a specific log, do we, Chris?
No, it's something that will be addressed in your safety plan. It has a like a template for not a template. It goes over what needs to be in the log, but I'm afraid there is no actual specific template. But your safety plan would address what exactly needs to be logged, and then it's just up to you to develop that log. And if you have any specific questions, just feel free to shoot me an email, or you can reach out to your inspector if you have kind of questions about what that log should look like. But it is something that's addressed in your safety plan. And it looks like Sandy Hollow is asking for the latest safety plan template. I don't actually believe that we have them posted online, but we can make sure that we get a copy out to you of the newest template. And I did go ahead and allow everyone to unmute themselves. So if someone does have a question, you can feel free to unmute yourself and ask, or throw it in the chat. All right, I'm not really seeing anything here, but thank you all for attending. We do appreciate it. If you do have things you want to talk about, if you have topics that you want us to address next year or just in the future, let us know. Feel free to email us either on my email, Anne's email, the PHP email. Let us know. We're happy to kind of mix things up. We do always wait for the New York State guidance to come out to see if there's something new to talk about, but sometimes there isn't. And we don't want to always repeat ourselves out here. So if there is something that you want to talk about, a specific topic, please let us know. We'd be happy to kind of throw in new stuff out there, something that you guys are interested in or just want to hear about. So we will send out a link for recording of this. We'll also send out a PDF of the presentation for you, so I'll have for yourselves. I will address the few questions that came up in that email or in a following email to make sure I clear all that up. But as always, let us know if you have any questions. Thank you again. Happy retirement to Jeff, and I hope everyone has a great camp season.